Hello and welcome back to In the Gray Area with Revv Health. I'm Brittany.
And I'm Travin.
Most people think that hormones are just about energy or libido, but the truth is that optimizing your hormones impacts nearly every part of your life. Today, we're going to be talking about the surprising benefits that most people don't know about. Things like brain clarity, mood, longevity, and even protection against disease. If you've ever wondered what balanced hormones really do for you, this episode will open your eyes.
This is one of my favorite things to talk about because we get, so many questions all the time about what are the benefits. And like you just said, everyone associates it with like the physical or like, muscles or like libido, right? Those are like the two common things when we talk about like testosterone, especially. And so, people don't even realize just, like the disease protection. And just like when you talk about like anti-aging, this is one of the best things you can do for that.
Yeah. One of the things that like for me, is like Alzheimer's.
Mm-hmm.
That is something that I've always just been super scared about.
Mm-hmm. Yeah, I know. I watched my father go through that, and it's like one of the worst things when you see a loved one like have to go through that, and it's just like cardiovascular disease. It's one of those things that it can be preventable, and it's like just doing the right things, and we all think, we all know how to eat right and exercise, or we should, and those are things that we know to be healthy to kind of like help prevent some of these diseases. But the next lowest hanging fruit is your hormones and optimizing your hormones to protect against things like that.
Yeah. And that's where sometimes when we get those people that are like, I just want to do things naturally, and we see how deficient they are, it can be so frustrating.
Yeah. Yeah. Like naturally is to have a natural decline and age. Like it's natural nowadays to die of a heart attack.
Yeah.
Like most people will have some form of cardiovascular disease. And so it's like, yeah, that's the natural thing to happen. But do you want that to happen? Does that mean that you shouldn't do things to prevent it from happening?
Especially when it comes to things that like I wasn't even aware of a few years ago when it comes to like on a genetic level with like even things within my family with like lipoprotein A and stuff. Like I didn't really understand that. And when people are coming to us and even questioning it, and then we're looking into it, and there's so many studies that show that optimizing your testosterone in return is then optimizing your estrogen, which is the only thing proven to help with something like that.
Yes. I'm glad when you were right before you said that, I was thinking in my head, like the lipoprotein part of testosterone. And that to me is like one of the best unknown benefits of testosterone therapy is its ability to reduce lipoprotein A and reduce, apolipoprotein B. And these risk factors that are, huge. I think most people in the cardiology world, now have kind of come to the realization that like apolipoprotein B is one of the most, biggest predictors of cardiac risk. And, testosterone, through estradiol can lower that significantly.
But here we have people scared of it. They're not only scared of like taking testosterone, that's one thing, but then they're scared of the way that it metabolizes into estrogen.
Yeah. Yeah, I know. It's one of those things. It's just not evidence-based medicine whatsoever. I mean, there's no study, like we talk about this all the time, but there's no study that shows that blocking estrogen is helpful. And in fact, the opposite, it's always harmful. There's no study that shows that, when you give a man an astrazole and lower his estradiol, that there's a positive outcome. For those of you guys who don't know, like when we talk about things like lipoprotein A and apolipoprotein B and being like significant risk factors, these are basically like the LDL particles that cause, plaque to build up in the arteries and increase like clotting factors and stuff. So when we talk about like cardiovascular disease, these are a super big, risk factor for, as we age. And we think of like plaque buildup in our arteries being, one of the biggest causes of cardiovascular disease. Lipoprotein A is one of the things that it's a genetic predisposition. And, if you ask most people, they'll say that there's nothing you can do to lower it. There's no medication available. There's no lifestyle things that you can do to lower it. You're just supposed to do the best you can to minimize the other risk factors. And so we know like firsthand, and we've treated patients with this, through raising testosterone and raising estradiol. We've seen lipoprotein A reduce significantly,
12 points in just a few months.
Well, in a few months, but I mean, it's like, we had the one patient, it went from like, over the course of a year from 112 down to like 80 or something like that. I mean, it's like, and these things do take time to happen, but it's just, to me, that's one of the coolest things about it, because it's like when we know that, cardiovascular disease is the number one cause of death, and there's so many things that we can do to help prevent it. And, hormones and like testosterone and estradiol specifically is one of the biggest things you can do.
Yeah.
Outside of lifestyle factors, of course.
And, we see that a lot even when we have breast cancer patients coming into us too. A lot of times they're put on the AIs and stuff. And so we have to kind of overcome that as well. But we know firsthand the safety, the protection, and the prevention, but how it goes hand in hand with balance. So men and women, totally different. We're going to treat a man completely different than we're going to treat a woman, but we will never block estrogen.
No, I mean, there's just no reason. There's, like we say all the time, there's literally no reason. There's no medical evidence to support that. And if, guys will talk about it all the time. If you're on the message boards, the forums, I mean, it's a very popular thing, high estrogen symptoms. But there is no such thing as high estrogen symptoms. If you are having symptoms from your testosterone therapy, it's because of, underlying insulin resistance that you have going on. It's your diet, it's your lifestyle, it's
visceral
inflammation,
fat.
Visceral fat. There's things, and the answer is not to just give a chemotherapy drug and block an important metabolite, but it's to let's address the things that are causing these, side effects. And, sometimes temporarily that might mean reducing the dose or adjusting the frequency or the type of delivery or whatever it might be. There's
adjustments.
There's methods that you do to, reduce those side effects besides, giving a harmful medication to someone.
Yeah, absolutely.
Yeah. And that doesn't mean to give someone DIM either, because that's also ineffective. And that's that's one of the things that drives me crazy. And we see it never fails. Anytime someone comes to us on a pellet, they're on a DIM supplement as well. And it's I don't know what it is about the pellet world that they think that they need to push estrogen down these certain metabolic pathways. But it's in that world, they think that it's certain metabolites of estrogen are cancer causing and harmful. And so they use DIM to try to push it down this pathway. And it's okay, yeah, DIM might do that, but there's no evidence that shows that provides any sort of positive outcome. So it's what are you doing? Why are you taking the supplement to alter these pathways? It's the same reason of when people have high levels of naturally occurring hormones, we don't try to manipulate the metabolites and push them down certain pathways and stuff. And it shouldn't be any different when you're on hormone therapy.
And we see that a lot with the pellets. Another reason why we do not offer pellets.
Yeah, they're trying to mask or compensate for the side effects that people are having from the fluctuations in hormones. It's not the hormone itself. It's that you are spiking up to, 1,800, 2,000, and then you're dropping back down to 200.
It's not mimicking the natural production. Another really cool thing that we've seen quite a bit now with both men and women is they come in and we're working with them for maybe 6 months, and then they're able to get off of their antidepressants.
Yeah. That's one of my favorite things to hear of. And it's we've been seeing it more and more all the time. And it's we had that patient a couple weeks ago tell us that they were able to come off their antidepressant. And it's just when you see how happy they are to talk about that and tell you that. And it's these people have been on these things for years. And it's sometimes they try to come off them in the past and they can't, but it's you get their testosterone restored and address, any other hormones they need to. And it's they don't need it anymore.
I know. I'm excited to get him in here to talk a little bit more about his experience too and some of the stuff that he's gone through.
Yeah, for sure.
Good story.
For sure.
And we've had people getting off statins too. So that's pretty remarkable as well. Yeah.
I mean, things like testosterone, thyroid, I mean, those are amazing for improving your cholesterol profiles. And it's one of those things that it does. We talk about the 12-month mark, it taking time. But I mean, it's testosterone, thyroid, things like that are so much more impactful at actually addressing the root cause is okay, why is this person's lipid profile the way it is in the first place versus a statin that's just going to manipulate the number on papers, but it's not going to improve outcomes versus the hormones where we're actually treating the root cause and we're, reducing the visceral fat. We're improving the lipids by doing that. And it's you get all these other amazing benefits from it too.
I know. That's why when people come to me and they're well, I'm too young to start something, or I don't want to take something forever, my mind is blown. You don't want to protect, you don't want to prevent, you don't want to feel better longer and live a happier life, better quality.
I know. And that's the thing, but it's going back to something like a statin, which is, the most prescribed drug in the country, but it's people have no issue jumping on something like that or taking something like that because their doctor gave it to them. But it's
forever.
But it's okay, the statin is gonna, increase your risk of diabetes and it's gonna lower your testosterone naturally and it's gonna cause these other side effects. But it's you'll take it, but you won't take something like testosterone that has nothing but upside.
So I know we talk a lot about the safety of estrogen and why we don't block it in men and women and how it metabolizes for men, testosterone and estrogen. But for me, going through all the training that we've gone through, it was crazy that it doesn't work the same for women. and to understand that like even while we're taking testosterone, it doesn't metabolize and convert the same way for us and drive our estrogen levels up.
Yeah. And it's crazy. And that's one of the things that was actually most surprising for me to learn. And probably like one of the like littlest known facts, I think, that probably most people don't even realize. But yeah, like when women take testosterone, it doesn't aromatize into estradiol like it does for men. And so that's interesting. And, women are going to make estradiol on their own. And, obviously if they're menopause, we're going to give them estradiol as well. But yeah, that's just an interesting thing that occurs.
Yeah. And it seems like just recently I've had more women even asking about that. Maybe like their husbands are on it. And so they kind of have a little bit of an understanding. But when we tell them that, I mean, it's kind of confusing for everybody.
Mm-hmm. Yeah. 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 It's just, I mean, it's one of those things too. It's probably not even worth mentioning to most patients because, it causes confusion and it's not really relevant most of the time because we're not as men, we rely on that conversion to get our estradiol. Whereas, women, you make it on your own and, then we're going to give it.
Yeah,
I
think
anyways.
I think it comes from a little bit of more of like that breast cancer world too, because they're so worried about they're suppressing their estrogen and everything. So they're scared that it will convert into estrogen. But
yeah, let's talk about DHT really quick because that is the other metabolite that testosterone converts into. And we talk about all the time that testosterone is a prohormone and it works through its active metabolites, estradiol and DHT. So testosterone will impact muscle fibers, muscle tissue directly, but all of the effects that we have in terms of like feel good effects, all of the effects on like health, we talk about the, disease prevention with like cardiovascular disease, diabetes, Alzheimer's, improvements in like libido, sexual function, mood, energy, all of those things occur through either estradiol or DHT. It's not the actual testosterone itself. And so, when we think about like, why would you want to block one of these metabolites when like that's what you're getting the positive benefits of testosterone from.
I don't think people really understand that.
No, they don't. And it takes, it's kind of it's not a hard concept for us to understand because like we're do this every day, but for a lot of people, like it is kind of interesting because you don't really think about testosterone that way. You just think about, oh, all these benefits come from testosterone. And a lot of times people will actually associate negatives with like estradiol or DHT. Like they'll associate side effects with those two metabolites. Like
hair loss.
And that's why they try to block those things. And so, but like, real quick, like, we talk a lot about estradiol, but DHT is actually, that's where a lot of the feel good components from, like when you think about like with testosterone, I always say all the things that you associate with testosterone, like that's usually DHT. So when you think about like the energy and just that like drive, that like motivation, the libido part of it, like a lot of that stuff comes from DHT.
We've covered a lot about testosterone benefits, estrogen, but one thing, especially for the female patients, a lot of times when they're coming to us, they've already got some things going on, whether it's autoimmune or they've been dealing with thyroid issues for years. And it takes quite a while to start seeing those benefits, like you're just talking about with hair. But they're losing a lot of hair.
Yeah.
And so that's something that we have to overcome too. It takes time. And, I was a hairdresser, so I understand that like hair grows in 3 different phases and that can take like up 6 months to a year.
Yeah.
And so we have to first get everybody optimized. And then it needs to be for a period of time before you're going to see that full cycle up to where like you're still going to lose some hair, but your hair is going to be fuller. It's going to feel better. It's not going to be as dry and brittle. And that goes with your skin too.
Yeah.
Like, so with thyroid, the benefits behind that is going to be hair, skin, and nails. And you see that usually between 6 months to a year.
Yeah. I wonder if a lot of women kind of thought about it from that perspective, if it would make a lot more if that would impact them more in terms of like wanting to pursue hormone therapy or like stick it out. And I know that might sound kind of vain, but it is. I mean, as we age, we start getting concerned, and more so women too, but with like our wrinkles and our skin and things like that. And instead of like, you can get certain procedures done and obviously like you want to take care of your skin, but treating it from like the outside,
the inside out,
right? Yeah. Like can have a big impact too.
Even a lot of times we get like women when they're in that like perimenopause stage coming in and all of a sudden they're feeling a lot of joint pain and they feel like overnight they went from, A to Z where they just feel old and achy. So DHEA has been very, very helpful for a lot of those patients.
Yeah. When you talk about like a little known kind of benefit or like a surprising benefit of a hormone, yeah, DHEA's impact on joint pain is huge. And it's like, I know for myself, even like when I was taking a certain dose of DHEA for a while and then I doubled it. And when I work out, like my joints feel a lot better. Like I seem to recover a lot faster and I feel better after workouts. And we see that play out with patients a lot. Like that's usually our first go-to, is if someone is complaining of a lot of joint pain, is we'll kind of give them or put them on a higher dose of DHEA. And like, honestly, a lot of times it resolves it or it helps it significantly.
Yeah. And that paired with testosterone makes a huge difference too.
Yeah. Yeah. Just, we always talk about DHEA and we tend to focus on other aspects of it, but yeah, the joint pain part is pretty cool.
Yeah. I get so excited when I'm talking to people though, and they start telling me that like they're feeling achy or they're feeling tired or they're feeling, you know, like no motivation, because it's so exciting to see the transformation that like we've felt and other patients and be able to like even explain that to them. But I think we kind of summed everything up, talked about the benefits with testosterone, estrogen, thyroid, DHEA. And
yeah, I think, you know, one of the big takeaways, like we always say, is stop trying to manipulate the metabolites or how these hormones, you know, metabolize in your body. Just let it occur naturally. And it's supposed to do that.
And trust the process.
Yeah.
That's really, really important. And be patient.
Yeah.
And also like within yourself, like give yourself grace because you did not get here overnight. So, and the sooner, like I always, like my kids, we've got 19 and 22-year-olds. I'm always telling all their friends, get your blood work done. Even if you're not having issues, like see what your baseline is as a younger man, younger woman.
I wish I'd have done that. I think that's super helpful for anyone. I mean, if you can get a baseline when you're, you know, theoretically when you're kind of peaking or when you have like peak levels of these hormones, and like, then you can kind of see where your kind of baseline is peaking out naturally. And then even if you're a young man and you feel great, then like perfect, then get lab work done and kind of see where your baseline is that you associate with feeling great. Because then like later in life, when you start to kind of have a decline, you can go back to that and say, okay, well, I was here when I felt great. And you know, now I'm here and like, I need to try to kind of get back to where I was feeling best at. And one thing I want to hit on too, is that you had mentioned about giving yourself grace. And that's something I think people should really pay attention to, because even when you're optimizing your hormones, and even when like you're doing everything right, like are there days where you still feel tired?
Absolutely.
Yeah. Or you might be having a bad day, or you're in a bad mood, or you're stressed out, and it's like life happens. And so I think it's important to remember that, like, just because you're doing everything right, and just because you have these beautiful hormone levels and a great testosterone level, like
doesn't mean life's going to be perfect.
Yeah. And you're still going to deal with things. And so
you're still going to get a cold. You're still going to get a sore throat.
Yeah. I think the takeaway is to just like, you know, so many times people will call us, or they'll want to have like this knee-jerk reaction because they have one off day, and then it's like, oh, I need to change something, or something must be off in my hormones. And it's like, yes, just give yourself grace and understand that life occurs.
Yeah. And that also goes back to like trusting whoever you're working with, because I still have patients that like we do follow up blood work and I'm like, okay, well, you're not taking this. And it's like, oh no, I stopped that. And it's like, what? Why? And like, why are you reaching out and even like asking? Nothing that we prescribe is going to cause you any harm.
Right. Yes.
So if you're concerned, you need to reach out and ask.
Absolutely. Well said.
Okay. Yeah. Well, I think that was a great episode. It'll help a lot of people understand a little bit more in depth. But like always, thank you for tuning in. Please like, comment, subscribe, and we will see you next time. Thank you.